predispose you. One being fertility, being in the reproductive age bracket, that increases your risk. If you're female, that increases your risk. If you're fat in terms of obesity, there is an increased risk if you're obese, though not anything that can be put down that if you're obese, you're definitely going to have fibroids. Okay. The other one was, we said female, fat, fertility,
fair, 40, the age, and
40.
Yeah.
Yes. By the time women are getting to their 40s and 50s, you'll find that the prevalence of fibroids has increased to about 50%.
Okay.
So you find that 50% of women over 40 or 50 may have fibroids.
Okay.
Yes.
Let's take a call and find out more about what people think about fibroids in our country. Hello?
Hello, good morning.
Morning, how are you?
I'm very well.
Okay, state your name, ask your question.
My name is Said.
Sorry?
My name is Said.
Said, yes.
Yes, from Mombasa.
Yes.
My wife has a fibro.
Yes.
10 years ago she was operated, and now she's facing the same problem again.
Right.
I don't know, is it common in that place?
Okay, thank you very much, Said. We'll try and get to your question. Let's take one more call. Hello? Hello?
Hello?
Hi, how are you?
I am fine.
Okay, state your name, ask your question.
I'm Dennis calling from Nairobi.
Yes, Dennis.
Yeah, I wanted to know, because I've realized the women who have not gotten a child, I've seen most of them getting fibroids. So I was thinking maybe when the woman stays without a child, it creates something that looks like a child.
Okay, Dennis, thank you. Thank you very much. Dennis had insights there. Okay, let's start with Said from Mombasa. His wife had a fibroid that was 10 years ago. She had it operated and it's back now. Maybe we can start with, why is it back? Was she supposed to be operated on? There are many questions there that we can try and help Said there.
Okay, that's a good question, Said. Number one, the surgery that your wife had seems to be what is called a myomectomy. A myomectomy is a surgery that is done whereby you just remove the fibroid itself, but you leave the uterus intact. Okay, so you try to remove as many fibroids as you can, whichever is accessible, with the least amount of complications. That surgery retains the fertility, but it has no guarantee that there will be no recurrence. As long as she's still in the reproductive age group, she still has her hormones intact, and so there is a likelihood of regrowth. Okay? The only cure that there is to fibroids, to say that if you've been treated and it will never grow back, is to have remove the uterus, have the hysterectomy done.
Do doctors give this option? Because 10 years down the line it comes back. Maybe she wasn't given the option. So the question of information, why remove the fibroid, or why not just stay with it and deal with it?
Yes, that is a discussion that you need to sit down with your doctor and discuss openly. Okay, because there are many factors to consider even before you start discussing surgery. You have things like the age of the patient. If that was 10 years ago, then most likely at that time maybe she still wanted to get children, and so hysterectomy is not a very good idea. Okay, 10 years ago is a long time ago. So if you're closer to menopause, most likely you've had enough children, then hysterectomy becomes a better option for you, especially if the fibroids are problematic. The severity of the symptoms is also a factor. If you're not having very severe symptoms, then surgery may not be a good option. You have the medical treatments that you can look into, okay, to try and control the symptoms, to reduce the size of the fibroid, and generally to improve your general health status.
Okay, I think we'll get into that a bit later. Let's deal with Dennis as well. I think for him it was more of a comment. He says when women don't get children, then it kills something, and I think the medical aspect would be the estrogen there.
Yes,
maybe again just reiterate the point that was made earlier.
Well, with the women who have not had children, what is called nulliparity, or if you get your children much later, then it is past that you've been exposed to the estrogen component of your hormones for much longer. Okay, so you've had an unopposed action for a longer time, and so you have a higher likelihood of developing a fibroid. So it is true, it's a good observation that he has made. Most women who have not had children will tend to have a fibroid or two.
Okay, fibroid and cyst, are they the same thing, or do they appear totally different in the human body, female body?
fibroids and cysts are two totally different things.
Okay.
Number one, in terms of composition.
Okay.
The fibroids are made of smooth muscles, which is what makes the lining of the uterus. The cyst is usually just a fluid-filled cavity. A cyst can occur anywhere, okay? You can have a cyst in your soft tissues, you can have a cyst within your pelvis. The ones that we're talking in this context then would be the ovarian cysts. And so these ones will occur most commonly within the ovaries. Fibroids will occur most commonly within the uterus itself.
Okay.
Yes.
I'm a lady, maybe 29, and I want to know if I have fibroids. I've not had any symptoms. I go about my day-to-day business just fine. Are there any indicative signs that I may look out for before I actually go to the doctor?
Okay, the main symptoms, as had been alluded to before in the segment, mainly what you need to look at is your periods, okay, your menstrual cycle. The first thing that people notice is the periods become much heavier than they were, okay, so you get much heavy bleeding, sometimes even with clotting, okay. Another thing you get is that you get bleeding in between your periods, meaning that before the date that you're expecting your period, you get a bit of bleeding or some spotting, okay. The pain that you get, which is called dysmenorrhea during your periods, or the cramping, then that may also increase. So those are the few signs that you can be able to get. Unfortunately, because of the family history, if in your family generally people tend to have heavy periods, which may have been a fibroid which went undetected, then most people will not really know, are my periods really that heavy? So they may present with the complication. They may have anemia, which is a fall in your blood level. And so those are the other things that you need to watch out for.
Okay, let's take another call. Hello?
Hello?
Hi, how are you?
Okay.
Hello? Yes, state your name, ask your question, I can hear you.
Okay, my name is Jane.
Yes, Jane.
I just wanted to ask the doctor, supposing you've been diagnosed with the fibroids and your uterus is removed, does it mean you become sexually inactive, you become infertile? Kindly ask the doctor to expound on that, the actual implication as far as when your uterus is removed.
All right, thank you very much. Okay, when your uterus is removed, just